This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222.
One last question from Shakir, who's live. What causes implantation failure for someone who is considered as healthy and would have no issues? And I've added your contact details in the chat.
Right, okay. Yeah, I mean, obviously a good look at what's gone on would be my first step. You know, how good were the embryos? What sort of quality they were before they went back? I mean, the sad part about IVF, well, it actually goes back to nature. A natural cycle at its best only has a 15% chance of producing a pregnancy. That's despite normal ovulation, normal sperm and open fallopian tubes. And there is good data to suggest that of natural cycles, something like 60 to 70% when couples are trying to get pregnant actually result in an embryo attaching to the lining of the womb and starting to secrete low doses or low levels of HCG. That's the marker. But of those 60 to 70%, only 15% actually make it past the missed period. So in nature, there is a significant implantation failure problem. So IVF doesn't solve that problem. What it does potentially is to create embryos that are of a better quality than what happens every month with a natural cycle, because we're screening out, by growing the embryos to 5 days, we're screening out a collection of embryos that were never going to make it anyway. So we now talk about, if you're under 35, a 35 to 40% chance per cycle, which compared with 15% is actually a big advance. But turn the other way around, 60% of cycles are not going to work. If we use genetic diagnosis pre-implantation genetic diagnosis to look at every embryo and sift out those that are abnormal, we push the implantation rate to over 50%. So a large part of the implantation failure is actually because the embryos were genetically abnormal, and nature has actually not let them go forward. So beyond that, we struggle. Of all cases we investigate for other causes, and that really is the lining of the womb normal? Yeah, there's a condition called endometritis, chronic endometritis. 1 to 2% of implantation failures turn out to be that. Shape of the uterus. Some uteruses are abnormally shaped and they have fibrous tissue rather than muscular tissue in the shape of the womb, and an embryo landing on that's going to be less likely to implant. So we go looking for those abnormalities of shape. Then there is is there anything in the woman herself that may be rejecting an embryo? There's a lot of talk about immunological causes. Now, there's one particular one, which is called antiphospholipid syndrome, which we know increases the risk of miscarriage, that women with that probably have a higher implantation failure rate. So we go looking for that. There are some of my colleagues who believe even further than that the body immune system actually in some way rejects a pregnancy, and therefore they use steroids, Clexane, but there is still no randomized controlled trial to actually prove they make any difference whatsoever. So I'm not totally convinced about immunology. Then diabetes, severe thyroid disease can probably play a part. So it's basically medical diseases, significant. But if you're healthy, that's not going to be the case. But it's worthwhile sitting down and going through the cycles, go through your own health, doing some basic blood tests, and so that's what I do when I'm approached by a patient that's had a couple of implantation failures. I suppose the other bottom end of that message is that 35 to 40% is the same for fresh or frozen embryos. So the more embryos you have, the more times it's 35 to 40%. And in data that we published almost a decade ago now, showed that after 3 embryo transfers, you have a 75% chance of a baby if you're under 38 years of age. So don't lose hope. And as one of my colleagues who got into trouble for saying this, but it's actually probably has a degree of truth in it, if you throw mud at a wall enough times, there will be a lump that will stick. So don't give up hope and keep on trying, but exclude things that are dealable with.
And don't forget that you can access all the previous episodes by going to our website www.theivfjourney.com and select IVF Journey podcast from the navigation menu.